Do you know what is disaster nursing? What are the phases of disaster nursing? And what is the nursing responsibility during the time of disaster and triage mechanisms? So let's all discuss in today's classes. Welcome to Nursing Guru and you're watching Nursing Guru with Jabbar Singh. Disaster is any occurrences that causes damage ecologically and loss of human life, deteriorations of health and health services. Disaster is not confined in a particular places. It might happen at any time, anywhere in this world. Disaster nursing is defined as adaptation of professional nursing skill in recognizing and meeting the physical and emotional need during the time of disaster. Disaster nursing can be divided into two types. The type 1 is called as natural disaster and the type 2 is man-made disasters. Okay, so as the name says, natural disaster, it occurs due to natural calamities. It might be tornadoes, it might be hailstorm, it might be tsunami, it might be flood, or it might be any sorts of communicable diseases. Like recently we have undergone the COVID also. Types of disaster. Disaster can be divided into two types. The first type is natural disaster and the second type is man-made disaster. Okay, so the natural disaster is, as the name it says, it occurs due to the natural calamities. So it might be tsunami, hailstorm, thunderstorm, a communicable disease. So these are the category will comes under natural disaster. And the second disaster is man-made disaster. So such as fire, explosion, bomb blast, terrorism, or a mass casualty. It happens in an hospital. So these all will comes under a man-made disasters. So next we will discuss regarding the goals of disaster nursing. Being a nurse, what is our goal? What is our objective during the time of disaster? Let's discuss one by one. Okay, so the main goal is to meet the immediate basic survival needs of the population affected by disaster. So to meet the immediate basic survival. So during the time of disaster, people might suffer, people might come with so many dangers. So they are in a dangerous situation. So meet the immediate basic survival, such as severe bleeding. So what to do during the time of bleeding to stop, prevent bleeding? What are the actions to be, measures to be taken? So those things we have to follow. So that is the primary goal, to meet the basic survival needs. And the second is to identify the potential for secondary disaster. Okay, even though a disaster arises, we should not leave, okay, anyhow the disaster arises, we have to concentrate on the disaster, what is happening at present. No, it's not supposed to do like that. Why? Because the main disaster, it may lead to a secondary wave for another disaster, other hazards. Okay, a fire explosion happened. Okay, you are treating only regarding the fire explosion part. The second part is to identify the potential of primary disaster. So due to the primary disaster, such as an explosion, a bomb blast, people may suffer with severe burn. So due to burn, the people might go to a dehydration and hemorrhagic severe bleeding, shock, anaphylactic shock, the people may reach us, and septic shocks, the people may also get into a part of way. So we should prevent those things. This is our goal, it should be. And next part is to correct inequality in assessing the healthcare and appropriate resources. So during the time of disaster, we being as a nurses, we should not create any inequalities among the peoples. Okay, so only these people should be treated, these people should be left over. No, we should not treat like this. It should be in a equal basis, everybody according to the triage system, which we are going to discuss in the upcoming slides. What is the principle of disaster nursing? So the first principle is rapid assessment in the situation and nursing care needs. So rapidly assess, rapidly know the vulnerability of the patients. Okay, so who all will be coming under vulnerable categories? For example, the people who are more than 65 years of age and below 12 years of age, The people who are in risk factors such as cardiac disorders or the people who are having immunosuppressive drugs, the immunocompromised patient, the CKD patients, so these all will come under vulnerable category. So we should rapid assessment should be done for those kind of people. The first point in principles. Next, triage initiation of life-saving measures should be taken. Triage. Triage is a degree of urgency in categorizing the peoples according to their risk factors. Triage can be classified into 4 different types according to the color code. There are 4 color codes will be kept during the time of triage managements. The first one is red, second is yellow, and the third is green, and the fourth one is black. Okay, so the red color is a tagline which we are giving for the patients, those peoples who need an immediate attention. So it is an emergency management situations. The patients are in an emergency situation. So we should immediately take care of the patients. Okay, such as the life-threatening conditions might be severe bleeding or the serious injuries, such as the patients may suffer with severe bleeding, which may lead to hemorrhage, and it may also lead to shock. So those kind of people should be given a tagline of red color code. And the second color code is yellow. So yellow is the color code which is given for the patients who are having delayed treatment. For example, they had an injury. They are also undergone the disaster, but still the management, it can take little more later when compared with the primary management which is done for the A category, that is red color. So the second category peoples will be triage mechanism, that is yellow, is delayed, such as fractures, a contused wound, a chest injury, or rib fractures, or anything it comes under in those categories. And the third category is called as green. So that color code is given for the patients who can able to walk, who needed treatment, but still at present they are like outpatients. It's not an immediate requirement, it's like required for the patients. So those kind of peoples will comes under the category of green. Okay, so that is minimal injuries if the patients are having. The fourth category is black. Black is given for the patients who are already died or morbid. They are going to attain death. We can't say. We can't, even though if you're giving treatment, we can't ensure that patient can able to survive. So those kind of peoples will be given, we have to put a tagline in them, that is black. The third principle of disaster management is selecting the use of essential nursing intervention and elimination of non-essential nursing activities. So we should be much concentrated on the immediate management should be done for the patients. If the patients are having hemorrhage shock, so our primary goal, the essential nursing planning should be done to stop the bleeding for the patients. So those interventions should be undertaken. And the fourth principles of disaster nursing is evaluations of nurse in environment and mitigations or removal of any health hazards. So evaluation, finally we are evaluating the patient's conditions and mitigating. You are reducing the risk factors. So what we can do, mitigation is like lessening the risk factors associated with the disaster management. So how can we reduce the risk factor? So that should be undergone. So these are the principles of disaster management. The next we'll discuss regarding the phases of disaster. Disaster happens in 3 phases. The phase 1, that is called as a pre-impact phase, and the phase 2 is called as a impact phase, and the phase 3 is called as post-impact phase. Let's discuss regarding the pre-impact phase. So pre-impact phase is an initial phase that occurs before the time of disaster is going to arise. Okay, before the time of disaster, this phase occurs. That is called as pre-impact phase. It is an initial phase of disaster prior to an actual occurrence, a warning given at the signs of the first possible danger. For example, a weather network says there is going to be a natural calamities Okay, a warning sign has been given for you. So what in this phase, what you'll be doing? You'll be preparing, get preparedness for the disaster. So pre-impact phase, it is an initial phase before the time of disaster. This phase occurs. Next phase is called as a impact phase. The impact phase occurs when a disaster actually arises. So this is a hardship phases. Okay, during the time when the disaster is like happening, so what is a nursing intervention, being a nurse, what we have to do? So those phase is called as a impact phase. Next is post impact phase. The post impact phase is recovery being during the emergency phases end and returning to the normal community orders. You understanding? A disaster before it's arising, it is called as pre-impact phase. During the time of disaster, it's called as impact phase. And once the disaster has underwent a complete natural calamities or complete destruction has happened, okay, finally the recovery time to a normal situation is called as a post-impact phase. During the post-impact phase, people may undergo four processes. People may undergo four processes. Those processes are called as denial, strong emotional response, acceptance, and recovery. So denial, strong emotional response, acceptance, and recovery. Denial is during the time of disaster. Let's keep some a life. The patient lost his life. Is known person, is well known person, a friend might be lost his life. So denial, they are refusing. Okay, the mindset of the peoples will be like refusing. No, it's not supposed to happen for him. So that is called as denial. They not agree about the situations. Second one is strong emotional response. So emotional response is like the peoples, they undergone an emotional changes such as crying, agitated, they will be like worrying, how can this happen? So this kind of situation is called as a strong emotional response. And the third one is acceptance. Finally, they will accept the situations. Okay, yes, it might happen, it is a part of life, I don't know. The third one is acceptance. During this third stage, the victim being to accept, yes, it undergone, nothing can be changed, and coming back to his reality, coming back to the later on to a normal lifestyle. That is called as a acceptance. And the fourth stage is recovery stage. So the fourth recovery stage is like crisis. During the time of crisis, how he is like recovered back from the crisis, and the victim feel that they can back to a normal situations. So this will comes under the fourth stages. The first one is denial, strong emotional response, acceptance, and recovery. Let's discuss regarding the management of disaster cycle. Okay, so disaster cycle, there is a disaster management cycle. Okay, hope you can see at the back side. Okay, so disaster management cycle. So disaster management cycle, hope you can see the slides. It's a circle over here. First is a disaster impact. Next, a response. Next, a recovery, a development, mitigation, and preparedness. So this is a disaster management cycle. The disaster management cycle, it has these categories. First one is disaster impact, a danger, and how you respond to the danger, and how you recovered from the danger, how you developed from the danger, and mitigations. In this lessen the mitigation is like you're taking a step to lessen the risk factor or the impact during the time of danger. That is called as a mitigations. Let's discuss one by one. Response. A response phase is an actual implementation of a disaster plan. A response activity need to be continually monitored and adjusted changing situations. You understanding? So response phase is an actually how we are responding during the time of disaster management. Okay, what is a response? Like I told you, how you managing the triage system. So how you're treating the patient, so how you're taking this disaster and making a recovery for the patients. So how you're taking a steps during the time of disaster and how you're taking it towards a recovery phase. So that will comes under the response system, how you're responding to the disaster. The second step is recovery. Once the disaster occurs, so how you recovered from that disaster is called as recovery phases. The organizing staff need to recover invariably, so such as how you will be organizing, debris should be removed and care and shelter should be made and damage should be assessment. You should do an assessment on the damages, where all the damages which may occurs during the time of disaster. So all will be discussed in recovery phases. So how you come out from the disaster managements. The fourth one is evaluations. And the next process, the next cycle of disaster management is evaluations and development stage. So during this stage, once you've done a response, how you responded to your disaster time and how you recovered from the disaster time, it will be evaluated during this time. And this time, what will happen? You are reevaluating what all the damages which may happen, and also you're making an initiative for the developmental phases. Okay, you're developing, okay, so this damages has happened at present, we can recover it from now. So that kind of things we are doing it in your evaluations and developmental stages. And the fifth stage is mitigation stage. So mitigation, as I discussed earlier, it is the step taken to lessen the impact of the disaster. And the next process is mitigation. It is a step taken to lessen the impact of disaster. So in mitigation phase, what happening? A disaster has happened. So what type of steps you can make so that you can reduce the risk factor? For example, you can take there is a power failure due to a mass casualty, a disaster, there is a power failure. So immediate installations of backup during the time of power failures, so you should implement. So this phase is called as mitigation phase, in which you're making an initiative to lessen the risk factor, to lessen the impact of disaster. And the next final phase is preparedness. So once you undergone a disaster, so in this phase, you will be prepared for the next time. What are the mistakes you have made at present? It should be not happening at the next time. So preparedness and risk assessment. The preparedness phase. So evaluating the facility vulnerability in this phase. It's called as a preparedness or risk assessment. You're checking once after the disaster has been undergone, you're responded, you're recovered, now it's everything in the normal state. So finally, you're evaluating it. The risk assessment you're doing, what are the mistakes you have undergone, what all you have done throughout this disaster process cycles. So those things will be observed in this phase. It's called as a preparedness or risk assessment phases. So next we'll discuss regarding the zones of disaster. Disaster zone can be categorized into 3 zones. Okay, so 3 zones can be implemented during the time of disaster. The first zone is disaster zone, where the disaster is happening. The second zone is treatment zone, where you assess the patients, where you provide an initiate treatment, where you triage the patient, is called as a treatment zone. And the third zone is transport zone, where you're shifting the patient towards an hospital. Okay, immediate transport you're doing for the patient, that is called as a transport zone. So during the time of disaster zones, organizing an effective disaster system, as I told you, in the 3 zones. The first zone is disaster zone, the second zone is treatment zone, and the third zone is transport zone. And in the treatment zone, you will be assessing each patient, and you will be categorizing these people according to their triage system, as we discussed in previous slides. And preparedness for the transport, you're get ready for the ambulances, you're preparing the patient for the transport, you're checking the airway, breathing and circulation. So these are the things you'll be like checking. So this zone is called as a treatment zone, and the final one is called as transport. You're shifting the patient towards an hospital. During the time of treatment zone, few things you should make availability of few things. So those things are the wheelchair, the stretchers, the backboards or spine boards, IV poles, splint and bandages, emesis basins, disaster tags, adhesive tapes and pens, oral airways, scissors, blankets, stethoscope and emergency trolley with equipped emergency trolleys. All the basic emergency medications you should be present in that, and all the wound care measures should be made in that emergency trolleys. So these are the things should be get ready during the time of treatment zone. The next we are going to see what being a nurse should be undergoing. The next we are going to see the major roles and responsibility of nurses during the time of disaster. First responsibility of a nurse: define health need in a affected group. The second need: establish priority and objectives. The third one: identify actual and potential risk problems. The next one is determine resources need to respond to a need identified. And the next one is collaboration with other healthcare vacancies and the government agencies. And the final one is maintain a unified chain of command. So you should wait for the commandment of the hierarchy. So what people are telling, immediately implementing those things. So these are the roles and responsibility of a nurses should be doing during the time of disasters. Okay guys, today now let's summarize the topics. First, we discussed regarding the introductions, what is disaster, how we have to do, what are the managements we have to undergo during the time of disaster, and what is disaster nursing, that is like adaptation of nursing professional skills during the time of disaster. And the next we have discussed regarding the types of disaster, that is the man-made disaster and the natural disasters. We have discussed few types. There are many things, but I have discussed only few types of disasters. Next, we have discussed regarding the goals of disaster nursing, in that the aims, the main objective, what is being as a nurse, how we have to take care during the time of disaster, we made it. Next, we discussed regarding the principles of disaster nursing, what all we have to undergo during the time disaster. Next, we discussed regarding the phases of disaster nursing. There are 3 phases that we discussed: the pre-impact phase, impact phase and the post-impact phase. And finally we have came in the post-impact phase. We also discussed regarding the denial, we discussed regarding a strong emotional response, acceptance and recovery, and finally we came to a disaster management cycle. So this is very much important, disaster management cycle. It might be also coming for a 5 mark questions. So it has an impact phase, response phase, recovery phase, development phase, mitigation phase and preparedness phase. So those things we have discussed briefly about it. And finally we have discussed regarding the zones. So what is disaster management zones? So there are disaster zones are present, as I told you, treatment zones, disaster zone, treatment zone. Next we are discussed regarding the disaster system. It be classified into 3 zones. First is disaster zone, and next treatment zone, and finally it may be discussed regarding the transport zone and triaging, where deal few words like what all during the time of triaging we are supposed to have, and what is triaging, what is a color code we have to use during the time of triaging, we were discussed. And finally we came to a conclusions with nursing responsibilities. Being a nurse, what is your role to do during the time of disaster? Any doubts you are having, please comment it below. For more videos, subscribe to the channel. Stay tuned for next video. See you all in the next classes. Until then, bye.